Hey everybody, this is Keith Sharp with Berkshire Hathaway PenFed Realty. Here again today with another small business spotlight. And today I'm with my chiropractor, Dr. Stephen Knoyer. He was referred to me by my good friend Miguel Mendez with Mendez Method. And it's nice to meet you, Steve, and glad you took the time to speak with me. So what inspired you to become a chiropractor?
Great question. So I was about 19 and I was experiencing low back pain just like anybody who's lifting weights in high school and college. Wasn't going away, wasn't resolving, so I decided to go down and visit my urgent care, and I wasn't getting anywhere. Eventually they just kind of said, are you interested in pain medications? I was very naive. I didn't understand that was even a thing. I went back a second time because I was having even more back pain because of course I didn't stop lifting, and I met a DO, and at that time chiropractors and osteopaths were the only two ones that were doing what we know as manipulation now. He adjusted me and it took away my back pain about 80%, and then that kind of sent me on the path of understanding that a little bit more.
Okay.
And that's the long version. There was another chiro that did a lot of sports rehabilitation in my undergrad, and I spent some time with him, and he's the one that kind of eventually guided me towards the sports world and chiropractic medicine.
Very nice. So what services do you offer?
So we offer a wide variety. I'm usually half of the business. My wife is the other half coming back from maternity leave. My main thing the world is cursed to bless me with complicated low back pain patients. So I offer an in-depth assessment. I'm in the process of finishing that up through back to the pro with Miguel, sir, and his technique. Graston, which is an instrument-assisted soft tissue technique. Dry needling, which is something people don't know about, but it treats a wide variety of everything from migraines, chronic pain, scar tissue. It's a really undervalued service. And of course, the regular adjusting if people want that. Taping, cupping, and then my wife is a little bit more with the sports med, with kettlebell training, and she's starting to specialize in pre and postnatal, because we kind of found out that when you're pregnant, I guess the world tells you to stop being a person. Right. So that's where we expanded to this year.
Okay, very interesting. So what, other than everything you just went over with me, what sets your business apart from other chiropractors?
So as you can see, it's a very small room, very small space, and there's only two people. There's myself, my wife, Dr. Bodenberg, and a third-party billing person. So it's in-depth, it's in-person, and it's one-on-one, as opposed to other offices. I get a lot of people who tell me, unfortunately, it's 5 to 7 minutes. The doctor's kind of in and out of the room. There's other things that other large businesses will do with this. It's kind of like a 40-minute appointment. It's very like mill, where you kind of have 4 or 5 things the chiropractor does you and you go away. Right. It's not really personal. It's not really one-on-one, and our goal is to really not keep you. We want to kind of give you the exercises, education, and get you to the point where you can kind of manage yourself. Right. If you have an exacerbation or a flare-up, that's when you come back and meet with us.
Okay, great. So what are the biggest challenges of owning a small business and trying to get new customers in the door?
Main thing is the constant circle of word-of-mouth marketing, social media, meeting other doctors, meeting other small businesses, or meeting other urgent care providers that we kind of try to market with. And the other thing that we get a lot with, like you mentioned, Miguel, a lot of personal trainers, and there's a few other ones in the area that we're able to have a conversation with. And once you get past that door, then we kind of have a decent referral. But the nice thing is having the other network in the area, where if you're not somebody that I need, or if I think you need to go spend time with a trainer more, we kind of are able to use those.
And do you use social media a lot to get new customers?
We do. We have a Facebook page, we have a Instagram page, and I don't post very often, but those are the 2 ways that you can find us through those. I try to make it a little bit more sports specific, and since I'm in a location that has Brazilian Jiu-Jitsu athletes, a lot of my content is for athletes, but that's not necessarily, doesn't mean that those can't be used for anybody who's just not active.
Okay. And what do you find the most rewarding about your business?
I actually like when someone comes in and they tell me, I've been to a PT, I've been to chiros, I've been to an orthopedist, they're telling me surgery's the last option, I haven't been able to get out of pain, but since this is a small office and it's one-on-one, I'm actually able to spend, my new patient appointments are a minimum 60 minutes. Might be very simple. Oh, I know what it is. It takes me 2 seconds to hear them, 2 minutes to hear them to give me what I need, and I'm like, okay, I know what you have. Sometimes I have to go through images, I have to go through history, I have to go through 10 years of what have you done, what haven't you done, And then at the end of the appointment, if I'm able to get that patient a little bit better, or at least understanding that they're not cursed with pain for the rest of their life, that's usually the things that I actually like to have I find the most rewarding with patients is them going, oh, why didn't anybody tell me I have a terrible posture?
Right.
And that's what makes my back pain worse.
Gotcha.
And those are the things I find most rewarding.
Okay. And finally, what advice would you give people who are looking for a chiropractor?
So my profession is very broad, and I've gotten a little smarter over the 12 years I've done this. So I usually tell people, try to find people who are willing to educate you. They try to teach you what exercises or what strategies that you should be doing to resolve the pain, and try to move you out the door. There are some exceptions to this rule where I may have a manual worker, or I get to work with a few pro athletes in the area, and they put their bodies through chaos every 3 to 6 months if they're prepping for a camp, or if they're marathon runners, I see them as they're peaking and tapering, the same with powerlifters. So those are a little bit outside the box of people that I generally see pretty consistently, or inconsistently. The main thing is if they're offering packages, you have to have x-rays, they're trying to push a bunch of supplements and you necessarily haven't run an evaluation of your diet, your exercise, your lifestyle. Those are the things that I would generally try to flag for any provider, whether it's a chiro, a physical therapist, an osteopath, anybody who's just trying to do a quick, well, you got to stay with me for the rest of your life, otherwise what I'm doing is going to go. And that's not necessarily the case. It's a little bit more fear mongering, and it's not best practices, but I can only kind of speak for myself.
Okay. Well, I appreciate you taking the time to talk to me. How can people find you?
So I have a website, it's called positivemovementssr.com. The Instagram is exactly the same, the Facebook page is exactly the same. Everything that you find on there goes either through an email or secondarily gets to me through a forwarding app. So you either speak to me or you speak to Dr. Bodenberg.
Okay, great. Thanks so much.
Pleasure.
Appreciate it.